Childhood vaccine could be more effective if kids receive the first of 2 doses when they're a couple of years younger. And here to explain this is Dr. Kristen Moffatt, an infectious disease specialist at Boston Children's. Great to see you, Dr. Moffatt. Thanks for your time.
Thanks.
Thanks for being here, doctor. We appreciate it. So this vaccine protects against HPV, and it's the most common sexually transmitted virus in the world. So why do we vaccinate children against it instead of adults?
Yeah, exactly as you say, Maria, it is the most common sexually transmitted infection. 85% of people will be infected with human papillomavirus or HPV in their lifetime. While typical HPV infections may be very mild, may even go unnoticed, the problem is that a couple of subtypes of HPV can lay dormant for years to decades after infection and can cause certain cancers in either men or women, but especially cervical cancer in women. So the goal here really is to prevent HPV infection before it even happens and thereby reduce the number of HPV-related cancers. So the goal then is to get people immunized against HPV before they're even sexually active, because that is how HPV is transmitted. And that would be the reason for trying to complete vaccination in adolescents.
Dr. Moffatt, you've led us into the next topic quite nicely. CDC recommends starting the HPV shots when kids are, it was between 11 and 12, but now the new study is suggesting between 9 and 10. So does Dr. Moffatt think that that is better?
So my understanding of this study is that it showed that children and preteens and adolescents were more likely to complete the 2-dose series if they started it earlier. This is a 2-dose series with the second dose being given 6 to 12 months typically after the first. So the study demonstrated that by starting it earlier, it gave preteens and adolescents just more opportunities to get that second dose and become fully vaccinated. And since the goal is to complete the vaccination series before an adolescent becomes sexually active, improving those rates of completing the vaccination series would certainly be a benefit. So it seems like a good idea.
The latest information from the CDC shows only 61% of teenagers in the U.S. are up to date on their HPV vaccine. It said only in my script, but I say to you, the question is, why isn't that number higher? But truthfully, 61%, that seems to be a pretty good portion of the public, of the kids. No?
It is pretty good, but it certainly could be better because the public health benefit of HPV vaccination will be best if there are fewer people infected with these HPV types that can cause cancer in the population of young people. And so that really is key there. And I think part of the problem is that understandably for parents who are consenting to vaccination for their 9, 10, 11, or 12-year-old, it's understandably very difficult to kind of wrap your head around consenting to a vaccine to prevent a complication of a virus that doesn't occur until decades later in life.
Right.
So that is, it's hard.
The vaccine's been available for what, less than 20 years or so right now. So
about 15,
yeah, about 15. So of course, most American adults are likely already exposed to the virus. How long does it typically take for an infection to develop into something serious, like you were mentioning, like cancer?
Yeah, it does. It takes years, more likely decades, which is why it's understandably hard, I think, for parents to wrap their heads around giving a vaccine now to prevent something that wouldn't even be happening until much, much later in adult life. But the goal here really is to prevent HPV infection and reduce HPV-associated cancers, which this vaccine has been shown to do. And that's much easier to do than to treat a cancer once it's already established.
Dr. Moffatt, thank you so much for being with us. Stay well.
Thanks, Dr. Moffatt. Take care.